More than 21 million Americans now have health insurance thanks to the Affordable Care Act. That is a new record. And for coverage starting this year, more than 5 million people signed up for the ACA for the first time. That's a pretty sizable surge in enrollment since President Biden took office. And according to Axios, at least a dozen of the states seeing the biggest uptick in ACA enrollment are Republican-led. New York Times opinion columnist Paul Krugman writes, quote, "I don't know whether health care will be a big issue in the 2024 election, but it should be. Biden has made health insurance coverage more accessible and more affordable for millions of Americans." Joining us now, Secretary of Health and Human Services, Javier Becerra. Secretary, thank you for being with us. To what do you ascribe this uptick in enrollment?
Alicia, probably the most important thing is we let people know what a great deal was out there for them instead of hiding it. The previous administration actually saw a net decrease in the number of Americans who were insured through the Affordable Care Act. We have now seen a net increase of more than 9 million people who are receiving quality health care through the marketplace. And so we just let them know the best deal in town is out there for $10 or less. The majority of Americans are getting coverage for a full month. You can't find a deal like that anywhere.
Mr. Secretary, as someone who was on the front line of trying to stop the ACA, it is quite a moment for me to see so many Americans embrace it, and for the administration to put a strong effort behind getting it to households across America. But there's still this idea of more to be done. There is, in fact, a coverage gap. The New York Times reports that more than 1 million poor Americans in states that have not expanded Medicaid are estimated to still be in the so-called coverage gap, stuck with income too low for subsidized coverage through the marketplaces, but too high to qualify for Medicaid. How do you see now expanding? You've gotten everyone's attention. Folks are coming into the healthcare space of the ACA, but there's still a lot of poor folks out there who are in those gaps. What's the administration's view of helping to close that and convincing to some extent those states that are still reluctant to get on board with providing expanded health coverage for their citizens?
Michael, perhaps the most important thing is to convince these state leaders in these 8 to 10 states that are still refusing to extend coverage under the Affordable Care Act to their populations that it's a great deal. Just go talk to the folks in North Carolina or the folks in Oklahoma who not long ago expanded access to Medicaid, who are using the marketplace. As you mentioned, the biggest enrollment on marketplace insurance coverage, health insurance coverage, is coming from states that are depriving their citizens of access to good health care. And so it's just, once people see that there is a good deal out there, a real authentic, it's real coverage. It'll give you what you need when you go to the doctor's office or to the hospital, and you won't go bankrupt. When they realize that this is real, it's true coverage, they buy it. And that's why we've seen record numbers of enrollment on the marketplace. That's why states like the ones I just mentioned have expanded access through the Medicaid program as well. We could get to the point of making sure every American has confidence that they'll have peace of mind going to the doctor or a hospital because they won't go bankrupt if people just accept it as leaders of their states, that citizens will buy the deal.
But, Mr. Secretary, part of that peace of mind for folks across the country relates to reproductive health care and reproductive freedom. I know you are not here with us at the table because you will be with the vice president tomorrow in San Jose, California, at an event where she's on this abortion rights tour, and it is going to San Jose. Can we just talk a little bit about the state, what your department, what your agency is doing to protect access to reproductive health care for folks across the country? I understand there is litigation before the Supreme Court, and that is not something you can get into here, but there are actions that HHS has taken.
And Simone, what I can tell you is that we have at every turn used the federal authorities that we have to protect everyone, and certainly a woman's right to get the health care that they need. That includes reproductive health care, that includes abortion, that includes contraception. And so we'll continue to defend those rights. We have been taken to court in some instances. We're going to fight to the very end to make sure that those rights are protected. But whether it is making sure that a woman has access to the contraception care that she has been told by her doctor would be appropriate for her, we're going to do that. Whether it's making sure that any American, whether or not it's a woman needing abortion care, needs to have access to medical emergency services. The federal law in place today says that if you are in an emergent situation and you need emergency care, you are entitled to get the care you need to stabilize you. It just so happens that in some cases it might be abortion. And so what we're simply saying is everyone should be entitled to get the emergency care that they need. That includes a woman. And so we're going to continue to fight that. We're going to make sure that in court we fight to the very end to protect access to mifepristone, a prescription medication that's been found effective for more than 20 years. We're going to continue to do that. We're going to educate folks on the rights that they have, and we're going to do everything we can to protect a person's privacy. Whether you're the patient or you're the doctor, you're entitled to privacy.
Secretary, as you well know, the presumptive frontrunner for the Republican nomination, former President Donald Trump, is out there on the stump talking about repealing Obamacare, ostensibly because he's mad that former President Obama's name is on a signature piece of legislation that has proved to be incredibly successful, part of his tour of retribution and grievance. I want you to indulge me in a hypothetical, if you will, Secretary. If Donald Trump were to gain a second term and Donald Trump were to attempt to repeal the ACA, what would that mean for Americans and for the American healthcare system?
Well, Lisa, that's the kind of speculation you never want to ever get close to having be reality, because it's not just that more than 21 million Americans who today have the peace of mind because they have health insurance coverage through the marketplace, but it's the millions of Americans who actually have access to care through the Medicaid program, because the vast majority of states have expanded access to Medicaid. It's also people who have a pre-existing condition. The more than 130 million Americans who no longer have to fear being discriminated against because they have cancer or because they have another condition that pre-existed the need for care and now can be denied coverage through their insurance company. That went away with the Affordable Care Act. That protection would go away if the Affordable Care Act is repealed. So all of those protections, the benefits that seniors have under Medicare through the Affordable Care Act, which gives them access to free preventative care, that would go away. It would just be ruinous for the healthcare system at a time when Americans finally have discovered what a great deal the marketplace and Medicaid expansion have been. So whether or not Donald Trump or anyone else tries to repeal the ACA, and whether or not someone takes credit, as I guess the former president is now taking credit for having put in the justices that helped repeal Roe, the bottom line is Americans have moved on and they're ready to actually protect Americans' care, not put them in danger again.
Mr. Secretary, we had Minnie Tamaraju on the show earlier today, and we just talked about the reality for women across the country when it comes to reproductive care. And depending on where you live in America, your access to care is different. I know that the administration took some actions on the 51st anniversary of Roe to protect access to contraception. Can you just speak to a little bit how these conversations around contraceptives and mifepristone, these are not hyperbole, because there is a concentrated effort in places across the country to limit access to not just the abortion pill, but also contraceptives. The former Vice President of the United States, Mike Pence, said on the stage not a couple weeks ago that if Donald Trump is reelected, he would hope that he would ban not only abortion, but put limits on contraception as well.
So if the tens of thousands of women who we know have been raped and can no longer seek the abortion care that they need in the state they reside is not enough to make people realize that this Dobbs decision is real, then everyone just has to realize in their own home they know someone who's probably been impacted. I have 3 daughters, all of child-rearing age. My wife is a OBGYN, a high-risk OBGYN. She has for decades worked with women who come in under very difficult circumstances, oftentimes needing an abortion. This is real for a lot of Americans, and taking away contraceptive coverage would simply make it worse, because now you would amplify all the voices of regret, of difficulty, of hardship that are out there today if we didn't have access to contraceptive care, because it is the principal means by which women are able to control their lives. It's hard for anyone to believe, but my 3 daughters today have less rights than my wife had as she was of childbearing age, only because they live in states like California or Oregon, where that is permitted for a woman to still continue to get their care. They don't have to worry as much. But there are a lot of other women who, based on their zip code, don't know where they're going to get the care that they really need.
Mr. Secretary, the KFF health tracking poll asked folks out there, which party do you trust to do a better job addressing the future of the Affordable Care Act? Democratic Party, 59%, Republican Party, 39%. Given what Simone raised with respect to reproductive rights, what I raised with respect to the health care coverage gap for poor Americans across the country, what do you see as the future of the ACA? Are we going to be in this back and forth, depending on who's in charge in Washington, will speak to whether or not the ACA survives?
Michael, the best poll is people walking with their feet or clicking with their fingers on the Affordable Care Act website, looking into the marketplace and signing up. The tens of millions who are now signing up, they're the ones that are talking. And remember, back in the 1960s when Medicare first passed, or go back to the 1930s when Social Security was established, there were all these naysayers saying, oh, it's never going to work. We should get rid of it. Let's repeal it. Today, you tell an American that Congress is trying to repeal their Social Security, and I guarantee you they'll walk and use their fingers as well to vote and let you know how they feel. Same about Medicare. So just as Social Security, Medicare, Medicaid are that trio that we count on, I think now you can add in the cleanup hitter of the marketplace to that, because it's Social Security, Medicare, Medicaid, and the marketplace now as those resilient efforts to protect, to ensure that Americans have the peace of mind that they need.
All right. Secretary of Health and Human Services, Xavier Becerra, thank you so much for coming on the program today.